Competency 1, Ethics and Regulation. Today we will cover Special Access Programs of Drug. So remember key points in a Special Access Program. 1. This is for those drugs which are not normally available for sale in Canada. Second, a doctor or a practitioner will fill the whole form for a patient to get the medicines. Then it depends on manufacturer and the reason whether they dispense the medication or not. So let's begin. Special Access Program drugs. This is called SAP, a request for access to drugs that are unavailable for sale in Canada. These requests must be submitted by practitioner. Remember, only a practitioner, a physician can request it. Must be access to drugs for treating patient with serious or life-threatening condition when conventional treatments have failed, are unsuitable or unavailable. So normally what happens that the practitioner usually use medicines which are available for sale in Canada because they are all covered either by the government or the insurance plan. Okay, but in case the conventional treatment is failed and the practitioner wants to go beyond the conventional treatment program, then they will fill Special Access Program form and request a medicine. The SAP is not intended to promote early use of drug or to conduct research or to circumvent the clinical trial or drug review process. The only reason to request an SAP drug is to treat patient. Okay. Now, what is the role of a practitioner? So, practitioner responsibility is to initiate request on behalf of patient, ensure that patients are well informed of the possible risk and benefit of the drug being requested and its development status. Third thing is provide a report on the result of the use of drug, including any adverse effect, adverse reaction to the Health Canada. Now what happened? How does it process? So SAP process, what happened that practitioner will submit a request which is called Special Access Request Form. It is consist of 2 pages and 5 sections, and practitioner needs to require to complete all 5 sections of the form. Most drug for acute, serious or life-threatening condition, they required short-term treatment, while for chronic condition a maximum of 6 months supply is considered per request. So for acute or life-threatening condition, there is a short-term treatment, but chronic condition only 6 months supply will be allowed per request. After 6 months, if a patient wants to go more with the drug or the drug is working for the patient, then he has or she has to request again. If a request is authorized, a letter of authorization is sent by fax to the manufacturer, and the copy sent to the practitioner. If the request is not authorized, then a letter will be sent to the practitioner with an explanation of why they don't authorize the request. Next is the when if it is authorized. Okay, the SAP may also contact the practitioner by telephone to discuss the reason for the decision. Both. Okay, process request within 24 hours of receipt. So it will take 24 hours when you request an SAP drug. The authorized drug supply can be sent. Now, the practitioner requests a drug, the drug request is approved. Now, where will be the drug goes? So the drug will be go to the requesting practitioner office or inpatient pharmacy or radio pharmacy or blood bank. So basically, usually what will happen that a patient with some unusual cancers or some life-threatening diseases, they usually use these SAP medicines or drugs. So that's why radiopharmacy is here. Next is what a manufacturer will do. So the practitioner will request, the pharmacist will receive, and then the manufacturer has right to impose certain restrictions or condition to release the drug. Why manufacturer will impose certain restriction? Because he is investing on a medicine. It is good for him that a practitioner wants his medicine, but if he doesn't use it properly or more side effect will come, the Health Canada will not gonna approve it. So there is a risk for manufacturer. Okay, so that's why he has right to impose certain restrictions and conditions on the release of drug to ensure that the use is accordance with the latest information available. Manufacturers are also responsible for providing all drug information to the requesting practitioner. Now the third question comes here. Who will cover the cost of the drug? Because it is not yet approved by Health Canada. There is no requirement for manufacturer to provide drug for free. But mostly manufacturer do. Why they do? Because it is a sort of free marketing. If the drug if the government will see that this drug is working and it is important for patient treatment, they will get early approval or approve easily. Okay, so that's why if a manufacturer is confident, they give the drug for free. But if the manufacturer do charge, then the cost will be covered by hospital or by public or by private insurance plan, or in some cases by patient. It can be paid by out of pocket by the patient or their families directly. This is the link for a special access program of Health Canada. I will copy it in the description. Those who wants to read by themselves or want to go through with the process, they can use this link. Otherwise, for exam, the summary which I explain is enough to remember. Thank you.